This is Tom Lee, editor-in-chief of NEJM Catalyst, and we're talking today about how Parkland Health, the public health system serving Dallas, Texas, is working to make respect a norm like hand hygiene, something that characterizes every human interaction. This last spring, on some of the nursing units, they started putting up stickers saying courtesy and respect on their Purell dispensers. They started on 3 pilot units, and our interviewee today is Lauren Toohey, the nurse manager on one of those units. Lauren is going to describe for us this work in progress and how it is affecting her and her colleagues on 13 Hospice A, the med-surg unit where she works. Lauren, before we get into this initiative, can you tell the audience a bit about you and your role on your unit?
Hi, Tom. Thank you so much for having me. Yes, I've been a nurse for about 11 years. I'm relatively new to the nurse manager role. I've been in it for 6 months, leading a very busy med-surg unit at Parkland Health.
So tell us the concept behind the Courtesy and Respect project and how it started at Parkland.
So in January of this year, I was approached by nursing leadership that Parkland wanted to pilot a project regarding courtesy and respect. And the project stemmed from the concept that courtesy and respect should be as common in healthcare as performing hand hygiene. And we would be placing stickers with a graphic of hand washing and the phrase courtesy and respect. There were 3 units selected. We included one of our mother-baby units and our medicine ICU and my med-surg unit to get a variety of different perspectives. The stickers were designed and approved by infection prevention, and we had our first meeting in February with our CEO, Dr. Cerise, and our chief nurse executive, Dr. Richardson, and also our nursing leaders to introduce the concept, set a start date, and brainstorm measurable outcomes. At the unit level, we started to discuss that we had been selected to participate in the project and started introducing the themes. In March, we applied the stickers to every hand sanitizer on the unit in our patients' rooms and in our core area, which is not patient-facing. We held a unit kickoff and invited executive and senior leadership to our morning safety huddle on the unit to truly drive home that the stickers are a reminder to be courteous and respectful with every interaction. And our patients that are being respectful is as easy and as common as hand hygiene. And having executive leadership there helped to show the staff the commitment and excitement that surrounded this project.
When we were in touch before, you mentioned that the blessings of the hands by the chaplain has special significance.
Yes, so when we had our kickoff event, we invited our unit chaplain to complete a blessing of the hands. In healthcare, this is a common ritual to remind us that our hands are one of the tools that we use to heal. And it tied the project in perfectly because we wanted to make the connection that our hands as healthcare workers are tools and that every touch point we have the opportunity to be compassionate, whether with a patient or a teammate.
That was so lovely because it made me realize there is a connection between what you were launching and, frankly, religious ritual. But I know from my own experiences, when stickers go up, they tend to become invisible pretty fast. And in June, you expanded the intervention by asking the staff to provide input. Can you describe what you did?
Yes, the stickers went up and they made it through multiple cleanings by our environmental service team, which was one thing that a couple of us were skeptical about at first. But we wanted to start to expand the project on our unit to focus on staff's perspective of courtesy and respect and to allow them to provide input on what does courtesy and respect mean to themselves, their patients, and their peers. And so we posted 3 large sticky notes, which each theme on them, and staff could walk up and write what they felt it meant to them. These Post-it notes were left up on the unit for about 3 weeks, and we got great feedback and participation. We compiled the results and used our bulletin board that had already been on our unit, which included our unit values, which we had a meeting in December, and our staff determined what are the foundational values that we wanted to have as a team as we were building a new team when I was hired on.
So what did the staff say were critical features for treating patients with respect?
Staff highlighted the importance of listening to patient concerns without judgment. They emphasized treating them as a person and not a room number. They felt it was important to smile and say goodbye to their patients at the end of their shifts. They felt it was important to keep their patients informed of what they were doing when they walked in the room and letting them know of changes to their plan of care. They also included something as simple as knocking on the door before entering the room and making small talk and providing the patient with reassurance and treating them the way that you would want to be treated if you were in the hospital.
Those things are so simple and so obvious, but doing them reliably is not something that happens most places. So doing them like hand hygiene makes perfect sense. What did they say about treating their peers with respect?
The first thing on the list was teamwork and being a good team player to your peers. They felt it was important to say good morning to each other and help answer call lights, even if it was not your patient. They felt it was important to be considerate of people's time, be ready to take a report on time. Being mindful of your tone and attitude. We're often in a lot of stressful situations in healthcare, and sometimes that's not our intent the way that we come across. So, just being mindful of that with our interactions and getting to know each other and show appreciation to each other in real time.
And what about respecting themselves?
So, staff mentioned being prepared for work, creating a work life balance, and utilizing PTO, especially to prevent burnout and that compassion fatigue. Setting boundaries, either with your patients or yourselves. It's okay to say no to things. Staying hydrated, taking care of your body while you're on your shift and even outside of work. And it was a reminder that respecting yourself actually enables you to treat others better.
You mentioned a vignette in which the stickers affected you directly.
Yes, so as managers, we commonly have to participate in service recovery. And there was a very challenging patient on the unit, and I was not looking forward to having a conversation with this particular patient. And so I went to the patient's room, I knocked on the door, and I put my hand by that hand sanitizer, and I saw the sticker courtesy and respect. And it was a visual cue for me to take a deep breath, reset my frame of thinking, and remember that this patient deserves for me to be open-minded, compassionate, and respectful. And that patient got a better version of me because of it.
And you mentioned how respect moments have made their way into bigger organizational meetings for nursing leaders at Parkland Health.
Yes, we've done a lot of work here at Parkland as we're on our journey to higher reliability, and we commonly share safety stories at the beginning of our meetings. And so we've started sharing moments of courtesy and respect in our nursing leadership meetings. They're quick stories of someone going out of their way to treat a patient, a colleague, or themselves with respect. And it's keeping the conversation alive and starting to build a culture where respect is a part of everything we do here at Parkland.
Well, Lauren, part of leadership is being willing to take an egg and whip up a great souffle. And I know that this is pilot work that you've been describing, and I wouldn't go so far as to say it's already transformed the culture of healthcare at Parkland, but it's a wonderful beginning. And I do think you and your colleagues have created a very lovely egg, and there's a chance that it may turn into a great souffle. You are early in your career, and I have high hopes that this is going to be a great vignette for you in giving you the sense that you can do something great in your day-to-day work. So we are going to be rooting for you. I do have real optimism. I know a lot of our colleagues out there will, and I hope that you and your colleagues are proud of doing this work. And we would love to check in if it progresses and becomes something bigger. because it'll help amplify your impact in U.S. healthcare. So thank you so much for taking the time to meet with me a couple of times and share this work with our audience.
Thank you, Tom, for having me and for allowing me to share the great work that we do here at Parkland Health. I've really enjoyed our conversation.